Welcome everyone. Thank you for taking time out of your busy schedules to join us today for another one of our webinars geared towards organizations providing healthcare services. Now, whether you work with the developmentally disabled, provide home health care, long-term care, or other services, we think that you will find the information presented valuable. If this is your first time joining us, welcome. After today's webinar, we encourage you to listen online to any of our previous sessions by going to our website at www.fieldsync.net and looking under the Webinars tab. My name is Kari Kuglin, and I'm the Product Architect at FieldSync and have been focused on our health solution for the last 2 years. With me today is Katie Simon, who is a master's level social worker with a broad healthcare background, including home health, hospitals, long-term care, and developmental disabilities. Today, Katie will be talking about digital solutions and what they can do for your business. Thank you, Katie. It's great to have you back again.
Thank you, Kari, for having me, and I'm excited to talk about technology and healthcare once again with your company. So thank you for having me.
So why don't you go ahead and share with us a little bit more about what you're going to cover today.
Sure. On today's agenda, we're going to talk about the advantages of using a digital solution, using technology to provide better service, benefits for caregivers, success stories of providers, and then also the process of changing to a digital solution. So let's just talk a little bit about technology and healthcare and where things are moving right now. These are just a couple quotes from Financial Channel, which is a blog online where people are talking about healthcare in general. So I just want to share a couple things with everyone today. One of those was a doctor in California diagnosing a patient in Africa, an Ohio woman on vacation accessing her medical records from an emergency room in London. A patient's vital signs can be monitored remotely from a hospital on the other side of town. These are all scenarios that just years ago seemed impossible. And so as the trends are coming with, the government saying, let's move to electronic health records, let's move to using technology, there's a reason for it. And another quote from the financialchannel.com is, data collection and data analytics was a very prominent topic, with some of the more forward thinking offers proposing using analytics proactively in health management and even in diagnosis. So it's just something that we really want to promote and talk about today, is that adding technology and having a digital view really can improve your business. So what are those advantages of using a digital solution? Some of those advantages are that you would have timely data collection. So information can get collected in real time, and you have the data in a digital format, which allows for you to have automatic aggregation. So once you get all that data, you can see it instantly. The data gets aggregated, so you have results within the same day. What that allows for is improved decision making, so that you can make a decision based on true, accurate data, not on data that may be hearsay or old or not up to date.
And that's something that you would struggle with in a paper-based solution, right?
Absolutely. Paper-based, sometimes you don't get the paper documents back for a week, 2 weeks, maybe even a month later. With digital collection, it allows for a team approach as well. So you don't have to fax or make copies of those documents, of the data, of what's going on with that particular patient. You can have team communication through a solution, and it's all digital, and everybody can report to the same location. What that ultimately allows for is an enhanced compliance. So everything is secure. You're not faxing, you're not emailing, you're not having hard paper copies lost in the back of someone's car. And not only is that compliance important, for HIPAA compliance, policies and procedures with Medicare and Medicaid, there's just a lot of different components that come into play for compliance when you add a digital solution. Using technology can definitely help improve the service that's being delivered on a day-to-day basis. For the clients that are receiving this care, having instant updates to the caregivers so they know what they're providing to that patient is so critical. You want to make sure that the caregivers always have current and accurate information, so what they're delivering to that patient is absolutely the best. What data is being collected, once it's aggregated and you can see all that information, you know it's accurate, it's great, it's perfect, and so what you're delivering to that patient is consistent with what their cares are needing. When you have various caregivers going in and out of these homes or working with different patients, providing consistent care is also very critical for that patient, making sure that they're getting the same things at the same time and going through the same process so that the data is accurate and everybody can receive current and up-to-date information. Also, with technology and all that information and data being entered by the caregivers in a consistent format, it's very easy to review what's going on with the patient rather than just narrative notes of trying, how do you aggregate narrative notes versus data collected in a technology solution where you have actual numbers and words that are consistent with one another.
And then using those types of numbers, then you can see what some trends are and things like that, right?
Yeah, you can see the trends, you can see the patterns, you can see where the patient truly needs assistance or help or where to make those changes because you, one, have a multidisciplinary approach because everybody can see information instantly, but also the caregivers are recording the same information so it's easy to review. And having that ongoing visibility allows for not only the caregivers to see what happened the day before so that if someone had fallen, gotten hurt, the next caregiver that comes in to take care of that patient knows, okay, yesterday they had a fall, they were injured, this was done, and so what they're providing that next day is consistent and accurate with what happened the day before. So how does adding technology improve the workflow with efficiency for your business? What it allows for is understanding of responsibility and accountability. And how this works is you can see the diagram on your screen here where a technology solution could be cloud-based, where management is entering information into the cloud, where staff and professionals would be able to access the information in a secure environment, but also share the information back and forth for that patient. Once data is collected, then there's typically ways to show that the task was done or the program was completed so that the staff and everybody knows those items were taken care of and that patient received all the cares that they were supposed to. So it holds your staff accountable. It holds the caregivers accountable of, I know I have a list of things I have to do, and by the end of the day, management can see whether or not those tasks were completed.
Well, and I know just from some of the customers that I've talked with, with the paper-based system, there's a lot of room for error. And, their staff can say, I did complete that task, or I didn't know I was supposed to complete that task. But with a system or a solution, then there's no questions. There's no gray area. You know exactly what's supposed to be done. And like you said, that really adds to the accountability of your staff.
Absolutely, which you can't do with paper. I've had staff turn in paperwork at the end of the week and it's halfway completed. Well, by the time I go back and ask them, hey, what really happened, or I need to know, a specific time or date of something, they're going, I don't know, it's been a week, I can't remember the specific details. Versus technology where they have date and time stamps and you have all that information through the system, but also have a way for checks and balances so you're compliant and your documentation is complete on a day-to-day basis. Also with technology, the education for staff is minimal. Healthcare industry, there is huge turnover. And so when you have a new staff come in to take care of somebody, you already have everything in a digital format for them to read. It's very simple and the training is minimal in order to get them up and running and understanding the technology.
And I'll show, I think, in a few slides here, Katie, our FieldSync health system, but I think you can, just from feedback that I've heard from our customers is they can have someone come on and on the first day they can go out and use the application and they know exactly what data they're having to enter and who they're meeting with, and they've just got all of it in front of them, so there isn't a whole lot of training other than just some basic training on how to use the application.
Exactly. So Kari, with that being said, would you mind showing us how instant information and accountability comes into play?
Absolutely. So let's go over to our FieldSync application. And what we were just talking about, let's use, for example, incident reports. So having instant access to information can be critical, especially when you're dealing with incidents where something has occurred and It may not, you may have individuals and staff that are out in a remote location or out in houses that aren't necessarily in the same building as you, but you're managing them and you're in charge of providing their care and managing their care. So having a technical solution such as FieldSync in those situations is key. So what I'll go ahead and show is our mobile application. So I'm going to come over here to my iPad, and you can see our mobile application here, and I'm going to go into logs. And so this would be the application that your staff members would be using out in the field. I'll come up here and say new. I'm going to create a new incident report. I'll choose my client, and this list only shows the individuals that have been assigned to me, so I have information only to specific people. The type of log that I'm creating is an incident report. And now based on that, I have a bunch of fields that you'll see at the bottom of the screen that are required and have been determined by my company as key fields to collect in an incident report scenario. So it auto-populates the date for me. I'll select the time. I'll just set the time to the current time.
And with this, it definitely makes a difference for the staff to know exactly what they need to fill out, exactly what they need to, what information they have to capture when an incident occurs. I know my staff has filled out incident reports. I get them back, and not all the boxes and everything is completely filled out. So having a system like this definitely has that checks and balance system already in place, so the staff isn't submitting paperwork that's only halfway complete.
Well, sometimes they don't know what information is important, so they might be leaving things out that they don't even mean to be. So let's just say one of my participants fell down. So I've got that in my title, I've put in some notes, and then I'll come down here and I can start to fill out all of the fields that are key to my organization. So here I'm going to start typing in the name, and I know that Mary was a witness. She's one of the other employees working with me. I can choose from a type of incident. So let's say it was an accidental injury. The location of the incident was community. We were out on our walk through the park. Were there any injuries? I can say yes. I can indicate exactly which body parts were injured. So I'm going to say legs because she fell down. I can indicate what the type of wound was. So let's say she got a scratch and a bruise from falling. Was first aid administered? Yes. And I'll just say applied bandage. Was injury referred to a nurse? I'm going to say no because it was a pretty minor injury. But I could indicate the name of the nurse, the time the nurse was notified. I'll say no for a workman's comp claim. I can also take a picture. So if I select on this button, then I'm just going to take a picture of my hand for right now. And I'll select to use that picture. So now you can see I have a photo of the injury. So what this allows is when the information goes back to the office, someone can take a look at that picture and know, pretty much immediately whether or not anything additional needs to happen. So,
and with the budget cuts of, services in the community now, and being able to have that information, RN services are getting cut back for community-based services, and so having an RN or somebody else take a look at what's going on without having to drive out to the house, have to view it, look at it, drive back and deal with it, you can actually get medical care through technology now.
That's a great point. Thank you, Katie. So I can also sign off saying that I was the one that, witnessed it. I can put in the date, I can get supervisor signature, and I'll pass through some of this for right now and save the record.
And so as you can see there, Kari received an alert saying that the information was not complete. So that's a great example for us to show that the staff can't submit an incomplete document to you. So again, it goes back to you're always going to have compliant and accurate information because there's alerts to notify the staff when they haven't done it correctly, but also so that the staff knows it's not done, you need to fix it before you can actually submit it. So it saves a lot of time for everybody in the long run.
So this type of log has been set up within FieldSync as one that requires notification. So it's asking me if I'd like to synchronize now. So I'm saying yes, and so right now that data is being sent back to the office. So let me come over here to my web application, and this is where I would be logged in as one of the office individuals. And I can come in here and come to my dashboard and see immediately that there was an incident report created. I can click on it and it brings up all of the detail that was just entered on the mobile, and I can see everything that happened. I can see where the injury was, I can see the type of wound, all of this data, and as I mentioned, there's a picture. So I can come in here as the supervisor, and I can also add notes and indicate whether or not additional first aid needs to be administered, or if there's anything additional follow-up that needs to occur, make changes to it, and then synchronize that information back down. So as you can see, it's really important and it's very beneficial to each agency to be able to have this kind of information instantly. And one other thing that I would like to add is, so if we take this incident report form, for example, within FieldSync, all that you need to do to add additional fields is to quickly go in and make changes within the settings. You can add a field. The next time that one of my staff members logs in to do an incident report, that new field will be there. So if there are any changes that come from Medicare or Medicaid and you have to start collecting new information, it's very easy to just add that to the form, and instantly your users know that they need to start collecting that information. And then again, as we talked about earlier, a multidisciplinary team, if there's some sort of incident that occurs and the documentation is there and it's complete because you have every single field indicated that you need to have completed, then everybody can log into this web-based portal and they can see all the information and make the appropriate recommendations.
Excellent. Kari, thank you for sharing just briefly what a technology solution could look like.
Okay, so with that, I do just want to kind of go through some quick benefits of FieldSync. As I indicated, you have access anywhere. It's a web-based solution, so everyone with an internet connection has accessibility. It doesn't require an IT person within your organization because we do all of the IT support for you. We host the servers. We can help you with devices. It's also customizable to your terminology. So if you don't call your participants, maybe you call them clients or patients, you can go in and change that terminology throughout the solution so that it fits what your staff is used to seeing. It's a very simple interface. You saw that, easy to use. It's a controlled environment. You have to provide a username and password to get into both the mobile application and the web-based application. And we also have excellent support and training available for all of our customers. So with that, Katie, I'll turn it back over to you.
Sure. And Kari, I just have one quick question. When you say mobile, some people may think of that as, oh, well, I have a laptop and I can take that anywhere, and that's mobile. So could you just briefly explain what you mean by having mobile with the solution versus just a laptop that goes out with nurses or caregivers?
Absolutely. So our application, our mobile application, runs on any iOS platform, which means an iPad, an iPad mini, an iPhone, or it also runs on any Android smartphone or Android tablet. So what that allows for you to do is really be out in the community and with your patients and, completely mobile without having to lug around a laptop. And with most of those devices having some sort of internet connection out of the box, you just utilize that connection and can send the information back to the office immediately.
Excellent. Thank you for that explanation. So I just want to share a couple success stories of providers who have gone digital and what that meant for them. just so that everybody understands that there are a lot of benefits to going digital and using technology in healthcare. And again, just reiterating the fact that the government and Medicare and Medicaid are also pushing for providers to go and use technology because they do see the advantages and also know that it can increase the quality of service that's being provided. So a couple of success stories and quotes that FieldSync has received include, FieldSync has exceeded my expectations in the level of regulatory compliance we've been able to reach and the areas that we've expanded the data collection. Another one is, as we open more facilities, the shared resources in FieldSync will allow us to expand without having to hire an entire new staff. So they're able to see and implement services through a technology solution versus hiring all these additional staff, which is not only a cost savings, but ultimately receiving that data instantly no matter where the offices are located. And then one more I just want to share is FieldSync is saving us 80 man-hours per month compiling data. Now that time is spent on compliance and improving care. So what's happening is all their data is getting entered digitally. The reports are getting done same day because the data is digital. It aggregates automatically. So now they can spend more time providing care and not worrying about the paperwork.
And Katie, just one thing that I'd like to add on that third quote, that was an agency with only 8 beds. So imagine the time savings and the cost savings for a larger facility that is providing services to many more people than that.
So if I was to make a change to a digital solution, let's just talk about some of the steps and how to do it. It's scary. It's scary going from a paper-based process, and always has been for a business or company. Changing over to a digital solution is concerning, not of the unknown. And so I just want to share some ideas and ways that you can actually go to a digital solution without making a huge change for your entire agency all at the same time. So first thing first is to take baby steps. Only implement it into a few houses or a few beds or with only a couple caregivers so that it's a slow process and a gradual process, so it's something that you can easily get used to rather than trying to make a huge change for everybody all at the same time. The next component is to make sure you find the right solution. So there are lots of different solutions out there and they are all targeted for different things, but just making sure that you find the right one that's going to work best for your agency, that can provide you with what you really need as far as your data collection and your reports and the information. And if you're looking for that mobile component, make sure they have a mobile component if that's what's needed for your agency. Preparing your current information is also very critical. Making sure that the information that you're entering into the digital solution is current and accurate will save you tons of time down the road. Once that information is entered, then you have it in there and you can make changes as you go along as things change. However, making sure it's correct and accurate from the beginning will save a lot of time.
Well, and Katie, one thing I would like to add there is a big benefit of a digital solution is once you have the information in there, making changes, you only have to make the change in one place and it gets distributed to everyone. So if a phone number changes, an address changes, instead of having to go and update the 15 different forms that piece of information is on, you make it in one place and it filters out to everywhere.
Another thing is to make sure you try the solution with your agency before you buy it. There's companies out there that offer trials, but just make sure that you try it so that you know that it's going to work for you. There's just a lot of different components that go into solutions, and every business does things a little bit different. So just make sure that you can have the ability to try any solution before you actually purchase it and implement it into your company.
And Katie, I would just like to add, obviously that FieldSync we do provide a free 30-day trial to customers because we see all the importance that trying the solution prior to signing off and making a big decision, we know that that's invaluable. So you can do a 30-day risk-free trial, and we walk you through the steps of getting set up, and you can get some programs in there, you can get some test clients in there, and just kind of use the system side by side with your current paper processes to get that level of comfort so that you know that how the data is going in, you can see that your reports are coming out correctly, and have that experience so that when you do make the decision to move to a full solution that you have that confidence.
Excellent. So then, once you do take those baby steps of implementing a solution into, maybe a few houses or with a few beds or a few caregivers at a time, and you've tested things out and you've found the right solution, then you can go into full implementation. So those are just recommendations of making the change to a digital solution from a paper-based process. So with that, as technology advances, your business should too. So this is the way of the future now, is technology, whether we like it or not as healthcare providers. It's not an easy thing, but at the end of the day, it's definitely going to improve your company compliance. It's going to provide you with more business opportunities, as you're going to be able to provide more care for more individuals. Your delivery of care is going to be more efficient, it's going to be accurate, it's going to be consistent, ultimately leaving you with the opportunity to provide a better quality of life for the individuals that you're serving on a day-to-day basis. So again, my name is Katie Simon. If you have questions or want to talk about healthcare and technology, or anything else in regards to this webinar or any of the webinars we've done in the past, you can contact me at the information you see there on your screen.
Thank you, Katie, so much for sharing your expertise with us again today. I just want to say that I hope everyone with us has gained some value from the information that we shared, and we hope that you'll be able to make it to our next webinar event. So make sure to watch your email inbox for an invitation to that event, as well as for a link to this presentation. Now, if you have any questions about FieldSync related to pricing, functionality, if you'd like to set up a detailed demonstration, please feel free to contact me using the information that you see on your screen now. And in addition, if you're interested in signing up for a free trial of FieldSync Health, you can also contact me and we can go ahead and get that started right away. So on behalf of the entire team at FieldSync, we want to say thank you for your time today, and we look forward to our future interactions with you.